This video will provide instruction on how to document a managed care summary in Meditech. The task that you're going to use to do this documentation is called Record Non-Visit Documentation. This task is generated when you schedule a managed care summary assessment in the patient's schedule and create a documentation task. That instructions on how to do that are covered in the quick video Scheduling Managed Care Summaries. So in order to document the managed care summary, you would click Begin on the Record Non-Visit Documentation task. The Record Non-Visit Documentation task has the same exact pages as the Perform Visit task with some minor changes. So the first page is Patient Overview. Start Documentation. You don't even need to put in a start date or time. It'll just pick up the time that you're actually doing the documentation. When you come to Document, you will see all the different branches that are on the tree when you're in a Perform Visit task. You will see the routine care steps and your plan. However, this is not you're not documenting visit documentation. You're focusing exclusively on the assessment managed care. So you can, if you want just to reduce your confusion, you can just hit the little minus sign in front of routine and the minus sign in front of plan. So you can just focus on the managed care summary assessment. So you would start off on your discipline-specific overview assessments. So this is just a general overview of your patient's current status. So you can check off the things that are problematic. You can write a patient's status note down here on your overview assessments if they're pertinent to that specific patient. So you would go through your overviews, document anything that you need to say about how your patient is currently functioning. The bulk of the documentation for the managed care summary is really going to be contained in these bottom care steps. So the first care step that you need to focus on is your primary deficits. So you could click in the details and you get your drop down. This is the same exact care step that you'll find in your initial evaluation, as well as in your 60-day that is on the first visit of the certification period. If you've already completed these in the 60-day summary or the initial eval, you can come up to Copy Prior Instance, and then you can see what you've documented previously. If that information is the same, double check your resource class. You don't want to copy anything that another discipline has used. You can always come up to the resource class filter, choose your discipline, just to make sure you're not accidentally copying another discipline's information. So you can hit copy. And then here would be a detailed assessment of your patient's current functioning. Just filling in the details up here is not enough. The managed care companies read these assessments in great detail, and they notice if all you're putting in is the details and those aren't changing. You really need to come down here, a detailed assessment. Which side of the body is weaker? What are the specific limitations regarding to feeding with ADLs? All of the details about your patient that are the deficits. You want to focus on what they can do more than what they can. So your primary deficits care step is very important. This is pretty much the prime narrative area where you're really writing a summary of the patient's deficits and why they need therapy. The next care step is called Progress and Effectiveness of Treatment. Again, we have a drop down here where you can say, how has this patient been responding towards your care plan? So you can come in and you can check off. Now, if your patient is lower functioning, maybe they're not making a ton of progress, but at least your prevention piece is working. So you can come in and say that the patient hasn't been hospitalized, that they haven't been to the ER, that they haven't developed any problems because of the interventions that you are performing. So you can click OK and save. Now, barriers to progress is very important from an insurance perspective, because We want to show why our patients are slow in making progress, why we can't fix all of their problems in 8 visits. So you can come in and choose from the list of any issues that are making their progress slow. Maybe they have a progressive disease process. Maybe the patient has some cognitive and behavioral issues that are limiting your sessions and their ability to generalize that knowledge. Limited attention to task, pain, seizures, whatever it might be, you want to make sure that you're telling the insurance company why they don't make progress as quickly as a child without these issues. So you would hit OK, save, and then any other details regarding the barriers you would put down here in the notes section. Home exercise program and safety training, you want to include any information. Now, it's okay to say that the caregivers have difficulty performing it. We know the challenges that our families face, so it's okay to say that they're not performing it consistently or they have difficulty performing it, because that can prove to the insurance company of why they continue to need our services and why just discharging to a home exercise program is not enough. Learning barriers, you would come in and indicate what are the learning barriers. Generally, if you're requesting continuation of services, you would probably want to say that they need continued reinforcement, and then also indicate if they have any cognitive or behavioral issues that are also impacting their ability to learn. You'll update your justification for home care services. We need to tell the insurance company why they need services in the home, why they can't go to outpatient, why their school services aren't enough. So you could pick the appropriate reasons of why they need services in their house. If they are school aged and receiving school based services, we can say that they're only focusing on educational goals and that that treatment is not adequately meeting their medical issues. If the child is 0 to 3, you can indicate that either early intervention services are not in place, or if they are in place, that they're not adequately addressing the patient's medical needs. You would update your justification of why your discipline is medically necessary. It's a very similar list to what is in the PT primary deficits. And don't forget, you can always, if you've already established this at the evaluation, you can come into copy prior instance. Make sure, check your resource classes, just filter for your resource class, make sure everything remains true and is accurate, and then you can copy those in as well. Your frequency recommendation, you would come over to the frequency tab and put in your frequency recommendation. Make sure that you're choosing your discipline. You don't accidentally check another disciplines. And then for your short-term goals, you can copy the short-term goals that you had documented on your evaluation. So you can copy those in, or they'll also copy in from any other point in time during the cert period. And then you can right-click, copy, and you can paste it down there, and then you can just give an update. You can say that the goal was met, goal has been partially met, and give an update of where they are. Partially met, able to maintain for 5 seconds. Continue goal. And you can do that for each one. So you can copy, paste it in, and this goal, you can say goal was met. The insurance companies focus particularly on progress being made towards the short-term goals. If you're not documenting either a measurable functional short-term goal and you're not documenting progress towards that goal, their chances are is the insurance is going to either decrease your frequency or potentially declare it to be not medically necessary. This is where you really get to show how effective the treatment is towards making a difference in this patient's life and medical status. If you're not documenting good short-term goals and you're not putting that in, you are putting the patient's services in jeopardy. So that is all the care steps. So just as a review, you're going to complete all of your discipline-specific overview assessments that are relevant to the patient's care. Some of them may not be, so you could skip those. PT primary deficits, you're going to put in the details, and here is where you're going to put in your narrative summary. Everything we need to know about that patient. You really shouldn't copy and paste this because the insurances do compare them from summary to summary, and if they look exactly the same, they either send them back or they deny the services. You have your progress and effectiveness. Your progress and effectiveness care step is where you're going to put in the details about how the patient has been responding towards treatment. You can also put in a detailed note if necessary, but your real details about your progress and effectiveness will probably be better written in the short-term goals care step, which I'm going to come to. Barriers to progress is where you're going to document what issues the patients have that delay progress, or why the patient isn't making rapid progress. You have your home exercise program and safety training, your learning barriers, justification for home care services, explain why this patient needs services in the home. We want to stop the insurances from asking, why can't they go to outpatient? Why aren't the school services enough? If we don't address this question here, they may either reduce or deny services altogether. You're going to update your justification, why your therapy services are medically necessary. You would choose the details here, up here. Writing a note is most likely not necessary because you probably would have written everything up here in your in your primary deficits anyway. You're going to report your frequency recommendations. Make sure you only choose your discipline. And again, short-term goals, very, very important. You want to copy in the existing ones, paste them down here. If the goal has been met, you will come up here, delete it, and then you can put in a new goal. You can click the plus sign and then update that goal. Improve dorsiflexion to 10 degrees. The insurances want to see a progression of your short-term goals. They want to see that something is happening. If your patient is lower functioning, this can be difficult. However, you just have to make your goals small enough that you can actually measure the progress that is being made. So if your patient is going to be more of a prevention of medical necessity, find something, and you really only need 2, maybe 3 short-term goals, the main focus of your care plan. That is what you should be putting here in those short-term goals. So that is the managed care summary. You will need to complete all of the care steps from the primary deficits all the way down to short-term goals. So that's 1, 2, 3, 4, 5, 6, 7, 8, 9. The overview assessments look really good to the insurance companies. It makes the summaries longer and it makes them a little bit richer when it comes to clinical documentation. Sometimes it's about appearances, and we want this to look good when we send it to the insurance company. If you only document on 2 care steps, it is a very bad looking managed care summary, and chances are it's going to get denied. So don't put your patient's care in jeopardy. Fill out as many of the overview assessments as apply to your patient, and then you must complete all of these from primary deficits down to short-term goals. Once you're completed all of the documentation within the managed care assessment branch of the tree, you can click next. Oops. Next, next. You don't need to complete a communication on a managed care summary. Complete documentation. You just need to click apply signature and hit finish. And that is the managed care summary documentation.